So now let's put hands together for Dr. Biswaroop Roy Chowdhury ji. So he is an international acclaimed medical nutritionist, cancer cure. So we invite you to speak a few words, sir. So can you all put hands together for him?
Honorable Chief Guest Ashok ji and my dear friends, it's a great pleasure to be here, and we should talk about the integrated medicine. That is what is being told till now by the previous speaker, by Dr. Anand Biradar ji, by Ashok ji. We should collaborate the good qualities of all the therapies. So with this idea, 2 years back, me and my friend and partner, Achar Manish ji sitting here, we started what we call as HIMSS, that is Hospital and Institute of Integrated Medical Sciences. So right now we are having 21 branches, 21 hospitals in India. In India it is 20 and 1 hospital in Malaysia. So if you come to our hospital, you will see the true picture of integrated medicine. You will find allopathic doctor, Ayurvedic doctor, homeopathic doctor, naturopathy doctor, all of them together. Patient-centric treatment. When the patient comes, he is not a patient of allopathic doctor, he is not a patient of Ayurvedic doctor, he is a patient. Patient-centric. So how we treat the patient, that's what I am going to show today. And ये screen भी है क्या? PPT. PPT. So that's what I am going to show today. And the topic right now you are having in your hand the book called The Rabbit Tortoise Model for Cancer Cure. And I'll just take, these are the 4 rules. If you understand these 4 rules, you will understand that any kind of cancer at any point of time is treatable and curable. And those who don't believe this, for them, today in newspaper, we have given a full-page ad. Acharya Manish has given a full-page ad in the major newspaper of Delhi, Hindustan, Amar Ujala, Dainik Jagran, where we have said that you come tomorrow, that is 23rd of July, Chandrasekhar Azad Jayanti, Bal Gangadhar Jayanti, and you will find the patients who use the same method which you are going to learn in next 10 minutes. So straight away come to the point. When we say cancer, so we have to understand in our body there is the rule number 1, there is one kind of cancer in our body, in all of our body, that is called indolent cancer cells. So this photo is there in the first inner page of the book which you are having right now in your hand. The inner page of the book you are having right now, you will find that photo. So at this point of time, anybody who is more than 40 years of age, probably we all are near to that. So 40% of the women are having cancer in their breast. 70% of the men are having cancer in the prostate. And 100% of us, more than 40 years of age, 100% of us are having cancer, detectable amount of cancer in our thyroid gland. But fortunately, those cancer cells will not kill us. That's why they are called indolent cancer cell. That means right now, if we all go for the biopsy test right now, those who are 40 years old, and show only the biopsy slide to the doctor, 100% of us will be called as a cancer patient. 100% of us. From the parameters set by the conventional doctors, they will say you are fit for chemotherapy, you are fit for radiation, etc. Even if we are not having any symptom, just a test, as far as biopsy is concerned. So the first rule says that we all are having cancer cells, and I gave you the percentage-wise, but they are called indolent cancer cell. It can be compared with a tortoise. As if a tortoise is right there, but the tortoise is not going to disturb us. not going to disturb this lecture. It will sit, it will sleep, but it is right there. Similarly, the indolent cancer cell, which is there with all our body, but it is in detectable amount. The problem is that if, fortunately or unfortunately, we go for biopsy, it will say, yes, your body is having cancer. The second rule is, the biopsy cannot distinguish between the cancer cell which can harm and the cancer cell which cannot harm. There are about 5% of us who are having a cancer cell which can harm. Those are called the cancer cell which are aggressive cancer cell. I call it rabbit type cancer cell. Imagine a rabbit inside the hall. What will happen? The rabbit will not allow us to proceed with the seminar. What will happen? The rabbit will jump from one place to other place and it will make the whole thing dirty, right? Create a chaos. So that kind of aggressive kind of cancer cells, if they are present in our body, they are the one which can kill us. Right? They are the one which will cause tumor, they are the one which will cause pain, they are the one which will lower your hemoglobin level, it will give you weakness, and it will give you the real sickness. But the problem is, through biopsy, only the doctor will tell you have a cancer cell, but whether it is a tortoise kind of cancer cell, which will not kill you, or whether it is a rabbit kind of cancer cell, that science has not yet established. Here, the important thing we have to understand about biopsy, which is known to be the gold standard of diagnosis. That means if the biopsy says cancer, this means at the end of your life. That is what is the perception of all of us, including doctors, XYZ, everybody, including the pathologists themselves. Very interesting thing you have to understand. Very, very interesting thing. You have to understand that how much we should believe in the biopsy results. For that, a study was done. And in the study, this is a biopsy slide. The same biopsy slide I'm talking about. In how we develop a biopsy slide, from the suspected part of the body, a small tissue is taken, and it is converted into slide, and that slide is being observed by the experienced pathologist, and pathologist, by looking at the slide, remember, looking at the slide, the pathologist decide whether it is a cancer or not. Now this slide which you are watching on the screen, this slide is there in your book also, the book which is there in your hand. This slide was given to 800 pathologists, those who are not connected to each other, and it was asked, tell whether it is a cancer or not. 19% of the pathologist says this is a normal cell. 38% of them said it is an abnormal cell. And rest of them said it is cancer. So this means whether you are a cancer patient or not, it depends on to which pathologist you have gone. It is not depend on your body, anything else, right? Just you change your pathologist, you will change your result, right? So you cannot depend on the biopsy report. And also, if all the pathologists say it is cancer, they cannot say whether it is a rabbit kind of or whether it is a tortoise kind of. That is one disadvantage of biopsy. Beside that, it is very painful, we know. It is extremely painful thing. For 84% of the people say it is very, very painful. It causes death, it causes injury, it causes permanent injury. All these things with the reference of the medical journal is there in your book. The pain threshold is for most of the people up to the 9 or 8. That is extremely painful process. So you're going through an extremely painful process which is not reliable at all. So, and I'm talking about the gold standard. The gold standard, that is the biopsy, nothing beyond that. I'm not talking of mammogram, etc., right? So this we have to understand. Now, if we talk of the basic mammogram, I'll take only 10 minutes more, right? So if we talk of the basic mammogram, it is being told that after 40, you have to go for mammogram every year, so as a preventive, so that if there is some cancer inside, it will be detected early and you will be saved. We can stop that there. That is how the story goes. But important is we have to understand what happens when you go for a mammogram, what it is. Mammogram is simply, if you see, so, iska video on karna zara. So, what you see in the mammogram, ye video hai, if you are listening, the controller. So in the mammogram, there are two plates, and two plates it comes together, right? Press the breast to the extent that it should be too painful to the patient. It is not a patient, it is an individual. Patient is one who is sick. And when the breast is pressed to that extent, what happens? The healthy cell inside the breast that breaks, and it causes internal injury. Internal injury, that is a wound. We have to understand the mechanism of wound healing and the mechanism of cancer is same. The wound healing process, if does not stop, that is called cancer. What is cancer? By definition, if the wound healing process does not stop, that calls cancer. Yeah, this is how the model of mammogram is. I made specially for you, and this is, say, a fruit. I put it and try to press it as much as I can, and after that, 2 days, what will happen? When you smell, it will be bad smell, it is already spoiled. Whereas the other one, it will be intact. So the same thing happens with the breast. You are creating cancer. You have to understand that. You are creating cancer. You are injuring your cells inside, and that is too painful, you know. And that injury, the body try to heal, and when the wound starts healing, and if that healing process does not stop, that becomes cancer, right? So mammogram, in the name of mammogram, people are creating cancer. Mammogram cannot detect cancer, it can create cancer. This is one thing you have to understand. If you stop going for mammogram, so automatically the number of, at least the healthy people converted into cancer, that becomes lesser, right? Now, the important thing is, many people in a hospital, they come to us running, right, and showing that I'm a 4th stage cancer patient. The stage word, how it came only about 20 years back. 3rd stage patient, 4th stage patient, how it is? It is PET scan. You see the PET scan report right here. The glucose with the radioactive material, FDG, is injected in your body. I said radioactive material injected in the body. Anybody with a very little knowledge must know the radioactive material, they causes cancer. So here the patient or the healthy person is going with the intention to detect the cancer, but actually he is trying to feed cancer because he is feeding the radioactive material inside his body. You have to understand this. You must be knowing, those who go for PET scan, they are told by the doctor themselves, they don't come close to the pregnant woman or small children for 1 week, because in your body there is a radioactive material. It may cause cancer to the pregnant woman or the small children. Just imagine, by just going near to the people can cause cancer to those people, because in your body radioactive material is traveling. Will it not cause cancer to you? So we have to understand whether we are trying to cure the cancer or whether we are trying to create the cancer, right? And how we know it is stage 3, stage 4? You see, wherever there are more shining, those are known to be cancer, as they tell it. But shining only shows that the place which cells which eat more glucose, in those cells there will be more radioactive material found, and they will shine. So eating more glucose do not translate into cancer automatically. You have to understand that. So PET scan cannot detect cancer. It can only detect which are the cells which eats more glucose, right? Eating more glucose does not necessarily means cancer. Or those cells which do not eat more glucose does not mean it is cancer-free. So there is no correlation that way. All the evidences are there in the book which is there with you. All the references are there in the book, right? So if tomorrow, as Dr. Anand Virada told, in LTG auditorium, we are having a challenge, and we gave a front page, full page ad in many newspapers. It will come live in Sudarshan News at 12 noon and live in Sadhana TV. What I mean to say, what I'm telling to you, it is not in the closed doors, right? These are the truth. So PET scan cannot detect anything. It can only make the people believe you are a 3rd stage cancer patient. You will see many times, though even 4th stage, as they tell this is 4th stage cancer patient, they look very healthy, absolutely healthy. They are actually healthy. Only in paper they are cancer patient. So here the 3rd rule and the 4th rule The third rule, that are normal people, healthy people, first make to believe that you are a cancer patient. Remember, any person, including me and you, if you go for chemotherapy, if you go for radiation, if you go for surgery, healthy person can get converted into cancer patient. Chemotherapy does not cure or control, for that matter, cancer. It causes cancer. If anybody says chemotherapy cures or controls cancer, I would ask, give one evidence, only one evidence. And if you ask me to show the evidence, I have already given the evidence in your book, in that book, which is there in your hand. If you open the page, you will see there are thousands of evidences which shows clearly chemotherapy causes cancer. Radiation causes cancer. Surgery causes cancer. Right? Those evidence there with you. So, what happens? First, make a healthy person believe that you are a cancer patient. For that, you have a tool, mammogram, biopsy, PET scan, and once you're convinced you are a cancer patient, even though there is no symptom, right? Even if there is a symptom, chemotherapy cannot be an answer because it will cause further problem. If you know any cancer patient, you will realize the moment before he gone to the doctor, he was quite well. Only when he started with biopsy, etc., the pain started, the discomfort started, the weakness started. Only when he went along with the conventional treatment, chemotherapy, etc., that is the time when the pain and discomfort, it grown. And then he is in a trap. Try to recall the history of any of the acquaintance who you know. So if you think chemotherapy is an answer to the cancer cure or even a control or even improving the quality or the lifespan of a person, it is not like that. There is no evidence. Neither there is any evidence, neither you can say by experience. No, it is the other way around. I have given all the evidences, right? You come to our hospital, you will see the patients, how they heal. Now the final thing, the last 5 minutes, what we can do, how we can cure if there is a true cancer. How we will know it is a true cancer? The first is if there is a tumorous growth, we will know that cancer is spreading. Or there is extreme pain, there is extreme weakness, weakness, there is no cause. We are not able to see why there is a weakness. If there is no fever, or there is a fever for many months, many weeks. So, or the hemoglobin is going down steadily. So these are the indirect, these are the marker which we can say it can be a rabbit type of cancer cell. It can be, or it may or may not be. But the idea is we have to see how we can reverse the symptom. What we can do so that his weakness goes away, so that his tumor stops and regress. What we can do, his fever goes away. What we can do so that he was losing weight, that stops and reverses. If we can do it, this means we have converted the rabbit into a tortoise again. If you want to get rid of the tortoise, it is not possible. It is possible only when you are killed or you are dead, right? We all have cancer cell. You have to realize, you have to understand that, and it will be there in our body like a sleeping tortoise, and let it be. Need not to diagnose. The last 5 minutes, how we can cure. And here, मुझे एक माइक चाहिए. माइक है क्योंकि मुझे उधर जाना पड़ेगा. यही वाला माइक है आपके पास या दूसरा माइक भी है? हैंडहेल्ड माइक. हैंडहेल्ड माइक है किसी के पास? Okay, so how we can reduce these symptoms? You need not to diagnose the cancer because there are no tool which can diagnose without any harm. So this means there is no point thinking whether it is a cancer or not, which kind of cancer, what stage, need not to go into that story. The only thing is if there are symptoms, that symptom which I told, it is in the book, how to reverse the symptom, right? For that, the first and the most important rule, correct the circadian clock. Circadian clock of the body. If you correct the circadian clock of the body, these symptoms within weeks, within days starts reversing. We have seen in our hospital, we see every day, and you can see when you do it. How fast? 1 week. 1 week, right? So certainly the patient can wait for 1 week. Patient is very weak, for example, fever is not stopping, for example, hemoglobin going down, for example, tumorous growth can be seen, lot of pain can be seen, lot of pus can be seen. These are the things. Whether it is cancer or not, but it is giving pain and discomfort to the patient. That is very clear. How I can get rid of this? Correcting the circadian clock. Now, how to correct the circadian clock? One rule, only one rule, that time as medicine. Time as medicine means what we do in our hospital, let the patient eat within the bracket of 8 hours. That is 10 a.m. to 6 p.m. If you go to our hospital, if you see any cancer patient, ask at what time breakfast is given to you, 10 a.m. What time dinner finished, 6 p.m. or 6:30 p.m. Right? That is 8 hours bracket. Eat within the bracket of 8 hours and fast for 16 hours. And that 8 hours should not be any other 8 hours. It is within the span of 10 a.m. to 6 p.m. Right? If you do it other way around, that is night 10 a.m. to morning 6 p.m., it creates cancer. When the sunlight is there, during that time only, you should finish your food. If you make only one rule for all of us, we don't have any pain, we don't have any discomfort, maybe little bit of diabetes medicine, BP medicine, little bit of fat, etc. That's what. Make one rule, don't eat after 6 p.m. And you will be surprised within 1 week. If within 1 week your blood pressure will start dropping, blood sugar will start dropping, your fat, excess fat, wherever it is, it will start going away. Right? It is not that only if excess blood pressure, only if excess blood sugar. So the rule is, for our cancer patient, eat within the span of 8 hours. I'm not saying what to eat. I'm not saying how much to eat. I'm just saying eating within the time frame. As you shift the time frame towards the night, what is happening? Your body get the cancer feed, right? Feed for the tortoise, right? Don't say it cancer, say it tortoise. Feed for the rabbit, right? So eat when the sunlight is there, right? And when the sun sets, stop eating. Before that, fill your stomach to whatever you want to eat, traditional food, whatever food you had been eating, but don't eat after that. If any diabetes, hypertension patient comes, or anybody with pain comes, first you say only one rule. Don't eat anything after 6 p.m. and come after 1 week. And then you say, how much is your blood pressure, how much is your blood sugar, how much is your fat, weight reduced, how much energy increased. Now you give the second step. Second step is what we say, DIP diet. How many of you know DIP diet? There are a few. Thank you. DIP diet. DIP diet is, you can find the book given to you, or in the Google you can find. Government of India, Ministry of Ayush, they did a clinical trial on DIP diet. Government of Nepal, Ministry of Health, they have also done a clinical trial on DIP diet. So in many countries, many clinical trial already done on DIP diet. The diet which I recommended about 10 years back, 2014, first time I developed, right? So I am sure you can get it from anywhere, or it is in the book. So after 1 week, then you say, in that duration, that is 10 a.m. to 6 p.m. for cancer patient. Non-cancer patient, 8 a.m. to 6 p.m. is okay. Let it be a little more flexible. If you can do it, in that duration, eat only DIP diet. Eat as much as you want. And DIP diet is not difficult. It is very, very simple. That is, till 12 noon, you have to be on fruits. And before lunch and dinner, you have to eat salad, substantial quantity. In detail, you can just see it. So we have seen by only two rules, and these two things can be done at home. We see a reasonable amount of symptomatic improvement in the so-called cancer patients. I don't can call cancer patient because we do not, that way we all are cancer patients. The only thing is we did not go for biopsy. Anybody who goes for biopsy after 40, thyroid, right, if you take any tissue, it will be cancer. So that way, technically we are all a cancer patient. Only thing is we did not go for that I say dubious test. A test which is so painful, so harmful, cannot give a reliable answer, but still we are going for. If anybody says biopsy is correct, right, it is very, very important. Show one evidence, at least one evidence. Because whatever I just said, I have given all the evidence in your hand. Now what to do from here, right? The first thing, although I strongly believe in integrated medicine in our hospital, many of our friends also are allopathic doctor, but I see don't believe anybody blindly. Believe somebody who shows some result and shows some evidence. I said DIP diet, but I said clinically 2 trials. If somebody said biopsy, show the result of the observation study? Is it consistently giving a valid diagnostics? So now you all are seeker of knowledge. So tomorrow we are launching a course that is professional certification course in circadian clock and Ayurvedic Panchkarma therapy. It will be launched by Chowdhury University in collaboration with Dayanand Ayurvedic College. Dayanand Ayurvedic College, Jalandhar, is the oldest medical college of India and about 200-year-old. And in collaboration with HIMSS Hospital, that is Hospital Institute of Integrated Medical Sciences. The founder is right here, right? I am the co-founder. And this is for the first time in the history of India that Panchkarma therapy is being taught by a medical college in the medical campus, right? So first batch, of course, will start from tomorrow after the launching. But after that, whether we'll be able to continue or there will be some rule to stop us, that we do not know, right? But surely for the first batch, we'll get a certificate. It is an online course, only 1 week. You have to come to the medical college to have a hands-on experience, and for 4-5 days you can come to any of the HIMSS hospital to see hands-on experiences, and you'll get a certification, and that will be one more tool. At least you will have 2 more tools. Circadian clock, how to correct that? I gave only one rule today. And the second is you will get Panchkarma therapy in addition to the traditional therapy which you are already having. So as Anand Biradarji, as Dr. Ashokji was saying, the emphasis include all the therapies together. The best way is to learn. And I think there's an opportunity, and most interesting is Panchkarma therapy, even I am not trained. So in the first batch, I will also join along with you. So this course detail is there in the book, which is there in your hand. So I hope that we meet again as a student. All the best. Thank you. Jai Hind. Dhanyavad.